A triple health threat is keeping Northeast Florida hospitals extra busy. Medical experts say cases of the flu, COVID, and RSV are rising and could get even worse as many people gather for the holidays. News4Jax reporter Eric Avignon joining us live to explain why this is happening, Eric, despite many people being vaccinated.
Well, medical experts say there are several factors contributing to that spike in viral infections. For example, while many people receive their COVID or their flu vaccine, there's still many who have not. Also, while there are people who got the COVID vaccine, they may not have got the booster, or they may require an additional booster. Also, we cannot forget the fact that there is no vaccine available for RSV.
UF Health, Baptist Hospital, St. Vincent's Hospital, Memorial Hospital, and its sister property, Orange Park Medical Center, are all dealing with patients suffering from the flu, COVID, or respiratory syncytial virus, commonly known as RSV. Jacksonville Center for Clinical Research Director Dr. Michael Corin says he has been receiving hospital status reports on infection spikes.
All the hospitals are just absolutely packed right now. There's waiting times to get into the hospital from the emergency room, and hospital administrators have been sending out information to all the physicians about trying to get people out of the hospital as quickly as possible.
Dr. Corin says that while many people are showing up at the hospital with either the flu, COVID-19, or RSV, there are some who are testing positive for two of those viruses at the same time. How is that even possible?
Well, you get hit by two different viruses. There are different viruses, and your immune system doesn't necessarily react to both at the same time.
But Dr. Corin says you can protect yourself, especially if you plan to gather with family and friends this Christmas and New Year's.
One, socially distance yourself. If you can, stay 4 to 6 feet away from other people, especially people who you don't know, and certainly people who seem to be at all symptomatic.
Two, Dr. Corin says if you're not vaccinated against COVID or the flu, you should strongly consider it. If you are vaccinated and boosted, but it's been a while since you had a booster shot, consult with your physician to see if it's appropriate to get another booster, especially if you have a pre-existing medical condition that could worsen as a result of a COVID infection. As for RSV, that's a different problem that doctors are still trying to address.
RSV does not have a vaccine now, but we are working with that in clinical trials. And that is a very interesting virus because we didn't think it was a real big problem because most people got it when they were very, very young, and we thought you were protected during the course of your lifetime. But in fact, there are different strains of that virus, just like everything else. And as you get older, you become vulnerable again.
Medical experts all say that proper hand washing is very vital when it comes to stopping the spread of these viruses, especially after shaking someone's hand.
Somebody touches their face, they cough on their hands, they shake your hand, you're going to get that infection. So please wash your hands frequently.
Now, this triple threat is of such concern that Ascension St. Vincent Hospital released the following statement that says, in part, over the last few weeks, Ascension St. Vincent's has seen a notable increase in the cases of influenza, RSV, and COVID-19. We encourage everyone to talk to their doctor and get vaccinated for the flu and COVID-19 if they are able to do so. Reporting live, Eric Avignon, Channel 4, the local station.